This segment is sponsored by VCU Health.
The doctor is in and you have questions. Today we're joined by Audrey Roberson, Nurse Manager at VCU Health. In 2020, in March of 2020, she witnessed the arrival of VCU Medical Center's first COVID patient. In December, Audrey was VCU Medical Center's first COVID-19 vaccine recipient. Today, she's ready to share a little bit more about her experiences with us. It's great to see you, Audrey. Thank you.
Thank you.
This is such an important conversation. We all have so many questions, but in that introduction, you've witnessed many firsts at VCU Medical Center. Tell us a little bit more about your role there with VCU Health and what it felt like to experience these firsts.
Yeah, so I am actually the nurse manager of the medical respiratory ICU here at VCU Health System. The medical respiratory ICU was the first unit, inpatient unit, to receive a COVID patient. In fact, 3 weeks from today, we will be celebrating the 1 year anniversary of receiving our first patient, COVID patient. So I've been here at VCU for 31 years. The last 13 years has been, I've been blessed to be in the medical respiratory ICU as an educator and now currently as the nurse manager. So I feel like my team has been on the front lines to witness this year and the journey that we've had to go through to manage our patients safely.
You know, it's so incredible on so many levels. And Audrey, you mentioned you've been there 31 years with VCU Health, and to experience this unprecedented year over the last year as we come to this sort of mental benchmark of it being 12 months, it's really just hard to believe. That's kind of an understatement. You also were the very first, although unbeknownst to you at the time, to receive the COVID-19 vaccine at VCU Medical Center. Can you talk us through that and what your experience was like?
Sure. You're exactly right. I had planned to receive the vaccine. I had made up in my mind. A lot of it stemmed from, number one, my mom is a 81-year young breast cancer survivor. And because of her tenacity and her strength, I know the fight, and I was there with her every step of the way through her breast cancer survivor fight. She's an 8-year survivor now, and I really did it for her, to support her, because when you battle breast cancer, you kind of feel a little fearless, like you can take on anything. And I just was determined that the COVID virus was not going to be her demise. But then the second thing was coming into work every day. And over the last year, seeing my team and what they needed to do to ensure the safety of our patients and provide the highest quality of care for our patients. And it's been pretty distressful, to say the very least, what we have seen over the last year. Most of us never thought in our entire career we would have witnessed this on the front lines. And so between those two things, it really was the impetus for me getting the vaccine. I had no idea I was going to be the first recipient here at VCU, but one of the things I focused more on versus being the first is I just could not be the last. So while I'm very grateful and humble to have been the first, I think it's really the people that come after the first that really are significant, because they will continue to be the trailblazers in order to ensure that our community is getting the vaccine.
And this rollout continues, the process continues, of course, very personal, your immediate family, your work family, those were your motivators. You had this vaccine, you've had the experience. We're learning more about what that feels like, literally, from people on your team there at VCU Medical Center who have received this. What would you say to anybody watching today who's hesitant in getting the vaccine?
Yeah, absolutely. So the first and foremost thing I encourage people to do is educate themselves and help educate others. You can't make an informed decision if you don't have the information at hand to make that decision. So seek out and talk to, there's so much information where you can seek out information on valuable sources, such as for us, the Virginia Department of Health, talking to your PCP, but really seek out valid, reliable resources to educate yourself. So that's first and foremost. And then after you've educated yourself and educated others, maybe in your family, I encourage people to talk to people such as myself and others that have actually gone and received the vaccine. I've not only received my first dose, but I received my second dose as well, and talk about that. I'm very real and plain and upfront with people about my experience with the vaccine, and I encourage people to do that as well. I've been placed in this very blessed position to be able to talk to people in my church and in the church community, to talk to people in school, to really talk about, again, my personal experience that I don't mind sharing, but also to talk about now I'm about almost 1 month from receiving my second vaccine, and I'm doing well. I feel great. I've not missed a day of work, and I continue with my regular routine activities.
Audrey, it's so important. And thank you for sharing those words and your experience, not only with me, with our viewers, with our community. We're almost out of time, but I would say in simple terms, why is it so important, in your opinion, to make sure that you get this vaccine?
Absolutely. This is about our community. It's about each individual and how we come together as a community. So I beg each and every one that is able to hear this broadcast, like I said, educate yourself. Number 2 is go and get your wear your mask. I know we are making headway with our vaccination processes and practices, we still need to be extremely diligent. So wear your mask. Please perform diligent hand hygiene, and please have a little more patience. I know that's asking a tremendous amount, but please continue to social distance over the next several months as we continue to battle this COVID. I know we have made great strides here at VCU Health System and in the Richmond community, and I know we will continue to do that, but it will not be done without the efforts and continued diligence of our community. So that is what I want the community to hear first and foremost. So thank you very much.
Well, thank you for sharing with us. And as you suggested, education is key. Audrey, we appreciate you for sharing your experience.
Thank you so very much. And thanks to everyone that is being diligent to practice safely. So thank you very much.
Yes, and we will share information now. As Audrey suggested, it is important to learn more, and to learn more, visit vcuhealth.org. You can also find them on Facebook and Twitter at VCU Health. Stay with us. Virginia This Morning returns right after this.